What if I told you there's a medical treatment that uses your very own body to heal itself? A therapy that takes your natural healing power, concentrates it, and puts it right where you need it? Well, today we're diving into one of the most talked about and honestly, one of the most controversial treatments out there. Let's get into the world of platelet-rich plasma, or as you've probably heard it called, PRP. So what do these absolute legends of sports have in common with, well, you? The answer is something called PRP. See, when world-class athletes get injured, they're always looking for that cutting-edge treatment to get them back in the game. And many of them have pointed to PRP as the thing that helped them recover from nagging injuries like sprained knees or chronic tendon issues. But what is this stuff really? Okay, so at its core, PRP is actually pretty straightforward. Your blood has a few main components: plasma, red cells, white cells, and, crucially, platelets. Now, you probably know platelets for clotting blood when you get it cut, but they are packed with hundreds of proteins called growth factors. These things are absolutely vital for healing. So PRP is what you get when you take a sample of your blood and spin it down to create this supercharged healing serum. So how do we get this liquid gold, as some people call it, from a vein in your arm into, say, an injured knee? Well, the process itself is a pretty cool bit of medical science. Let's walk through how it's actually made. It's really a four-step journey. First, it's just a standard blood draw, nothing fancy. Second, that tube of blood goes into a centrifuge, which is basically a machine that spins incredibly fast. This spinning separates the blood into layers based on density. You get the heavy red blood cells at the bottom, a layer of platelet-poor plasma at the top, and right in the middle, this thin golden layer. That's the PRP. That's the stuff they carefully pull out and then, finally, inject directly into the site of the injury. So what's the magic sauce here? What's actually in the PRP that does the work? Well, it's all about these proteins, these growth factors. Now, don't worry about memorizing these names. Just think of them as the foremen on your body's construction crew. They're the ones shouting out orders to repair damaged tissue, telling inflammation to calm down, and even building new blood vessels to bring in supplies. So the key thing to get is that PRP isn't just plasma. It's a concentrated delivery system for all these critical healing messengers. Now, this all sounds amazing, right? A totally natural, super concentrated healing therapy from your own body. But here's where we hit the biggest, and I mean biggest, problem with PRP. Just because two treatments are both called PRP does not mean they are the same thing. Not even close. This quote from a major review in the Journal of Bone and Joint Surgery just hits the nail on the head. Scientists who are trying to figure out if PRP actually works are tearing their hair out. Why? Because when they look at all the studies, they find it's almost impossible to compare results because everyone is making their PRP differently. It's a huge mess. And this chart just shows you the problem perfectly. Take a look. Every single dot on there is a different PRP protocol from a published study. You see how they're just scattered all over the place? That's because of the huge variations in how fast and how long they spin the blood. It's like 1,000 chefs all claim they're making the same soup, but some are boiling it for 5 minutes and some are simmering it for 5 hours. You're not going to get the same result. And let's break that down even more, because it's kind of wild. The amount of blood they start with can be anything from a tiny 8 milliliters to almost half a liter. They're using at least 24 different machines to process it. But here's the real shocker. Only 28% of studies, less than a third, even bothered to report the final platelet count. That's the whole point of PRP. For you, the patient, this means it's a total gamble. You have no way of knowing if you're getting a potent, concentrated dose or something that's barely different from your normal blood. Okay, so knowing all of that, knowing that the recipe is all over the map, the million-dollar question is, does any of it actually work? Well, let's turn to the field where PRP really made its name, orthopedics, and see what the evidence says. And to be blunt, the results are a total mixed bag. This is one of the most hotly debated topics in the field. The science is still figuring it out, and whether PRP actually helps seems to depend entirely on what you're treating. There is absolutely no one-size-fits-all answer here. This little scorecard gives you a pretty good snapshot. So for something like chronic tennis elbow, the evidence is actually quite promising. But then you look at knee osteoarthritis, and it's murky. Some studies say it helps more than other injections, but we really don't have good long-term data. Then you get to rotator cuff repair, where it's just controversial. Some studies show no benefit at all. And for Achilles tendinopathy, the current science just doesn't support using it. But the story of PRP doesn't stop with just bones and tendons. Oh no, this same basic idea is now being tested out in some completely different areas of medicine, pushing into some really fascinating new frontiers. So, in the world of aesthetics, PRP has become a pretty big deal. It's the main ingredient in those vampire facials you might have heard of. The theory is that the growth factors can help rejuvenate the skin, improve its texture, and reduce fine lines. It's also being injected into the scalp, hoping to wake up dormant hair follicles and help with certain kinds of hair loss. And maybe one of the most surprising new uses is in assisted reproduction. For some people who are struggling with fertility, one of the roadblocks can be a uterine lining that's too thin. So some very early studies are now looking at whether injecting PRP directly into the uterus could help thicken that lining and hopefully improve the chances for a successful embryo transfer. All right, so after all of that, how it's made, the massive consistency problems, the mixed bag of clinical evidence, where do we land? What's the final verdict when we put the hype up against the reality? Let's recap the big points you gotta remember. First, PRP is not one thing. It's a whole category of treatments, and they can be wildly different. Second, and this is so important, for most of these conditions, this is an off-label use. That means the FDA approved the machine that spins the blood, but they have not approved the act of injecting it back into a specific joint or tissue, and that's a big reason why it can vary so much and why insurance almost never covers it. Third, as we saw, whether it works really depends on the injury. And finally, the single biggest takeaway. Until we get some standardization, we're never going to know the true potential of this stuff. And that really leaves us with this final thought. The whole conversation around this has to change. We need to stop asking a simple question like, does PRP work? And start asking the much more specific, much more intelligent questions. Which PRP are we talking about? For what specific condition? And for which type of patient? Answering those questions, well, that's the real key to unlocking the promise of using our own bodies to heal ourselves.